Hi guys, and welcome to Treatments Part 2. And these notes will be looking at two different other types of therapies or treatments for abnormal psychology, which will be behavioral therapy and cognitive. And the good thing about behavioral is this is going to be a lot of review, so going back through classical conditioning and operant conditioning. So it's good review right before your test, and it hopefully should make a little bit more sense to you because you've already understand these basic concepts. And then cognitive therapy, we'll talking about thinking and how people can think through their disorders. Okay, so at the end of these notes, you need to know these two, but then we're going to go back and review like a chart that looks at all four that we've talked about, the behavioral and the humanistics from last time. All right, so classical conditioning. Actually, let me go back. I skipped this slide. So behavior therapy is looking to modify behavioral. I'm going to move this over here. There we go. So behavioral therapy is looking to modify behavior, right? So if someone is feeling anxious, if it never manifests itself into a behavior, there's not necessarily something that you can treat. So behavioral, remember with classic and operant conditioning, those techniques of Skinner, they were looking to modify a behavior, not necessarily a way of thinking, but something that manifests itself as a behavior. So let's go back and review a little bit what classic and operant are. So remember in classical conditioning, these are natural reactions that occur with a stimulus that used to be neutral. So a neutral stimulus like a white fluffy bunny is then associated with that loud bang, and then all of a sudden you start to associate the bunny with fear, right? So classic, the baby Albert started to become afraid of the bunny even without the sound anymore. Same thing with the dogs. So the dogs used to start to drool when they heard the bell and they didn't even need to see the food anymore. Versus the operant conditioning, you're taking two stimuli that before had no response to them. So you weren't ever naturally afraid of things, but because of learned, remember operant, more like learning things, because of learned conditioning, you learn to be afraid of those things. So the operant conditioning are things like behavior modification with raising your hand, right? So you didn't naturally raise your hand to answer a question, but because that behavior was reinforced somehow, either with punishment or reward, remember giving or taking away things, that you learn to raise your hand. Okay, so that's just a brief review to start talking about classical conditioning therapies. So how can we use those types of classical conditioning to change our behaviors? So all of these right here, I didn't do a good job with these notes. So counter conditioning, these are all going to be examples of classical conditioning therapies. So somehow in your notes, make sure that the heading is classical conditioning, because we'll be talking about operant here in a second. So counter conditioning, this is kind of how it sounds. I like these vocab words. I'm going to take an old response that I don't like, so an old learned response, like being afraid of something, and I'm going to try and replace it with a new response. So I'm counter conditioning. This is a learned behavior somehow that I'm afraid of spiders, and I'm going to try and counter it somehow with replacing a new reaction with an old one. So counter conditioning, like unlearning my classical conditioning. Now there's a couple ways you can counter condition. One of them, and a lot of these are associated with phobias, is an exposure therapy. So exposure therapy, again like it sounds, I'm gradually or I'm exposing the patient to something that makes them anxious and teaching them how to learn a new response to that. Okay, so there's a couple ways that you can expose people to things they don't like. The most common one is systematic desensitization. I still can't talk. But systematic desensitization is when you are gradually introducing something that makes that person, that brings about that behavior. So I'm going to focus in on anxiety, but you don't necessarily have to deal with anxiety for these things. So anxiety is going to be my example here. So if I'm trying to desensitize someone to their fear of a snake, by gradually introducing that snake to them in a pleasant, so a calm situation, gradually, I can replace that fear with something else. So say I bring a picture of a snake into the room if you have a phobia of snakes. At first we would bring that picture of the snake into the room and talk about the anxiety that you have and how you're going to replace that anxiety or that fear with something else, right? So counter conditioning. The next time I might bring an actual snake into the room, but keep it very far away and teach you how to desensitize yourself or become less anxious with the snake. And then bringing the snake closer and closer and closer, right? So I'm aiming to replace that negative fear with a positive, relaxed situation. I'm countering the initial response I had to the snake. Okay, so that's one type of way that I can expose with counter conditioning. Another type of way is virtual, and this is more with things like public speaking or flying, things that are hard to, you can't gradually take someone onto a plane, right? You're either flying or you're not. So they have techniques that's a virtual, and again, it's a progressive simulation, but it's a simulation. So it's kind of like a video game. So if you look up here, here's a picture of someone with virtual reality exposure therapy. So think that virtual reality, it's kind of like something that's not real. They're watching it happen. But again, I'm trying to teach them how not to be anxious when they're exposed to these things that used to make them anxious. All right? And then aversion conditioning, this is actually the opposite of systematic. So aversion conditioning, do I have an example next? I do. Okay, so aversion conditioning is when I actually want to teach them to avoid that situation. Okay, so instead of trying to replace a positive with a negative, I'm trying to replace a negative with a positive. So aversion conditioning, I'm trying to avert them from that thing. So here's an example of aversion therapy, and you might want to write down this chart. So the unconditioned stimulus before was a drug. Remember, an unconditioned stimulus meaning that there's no type of learned thing with it. So the drug, the unconditioned response is that I became nauseous. So I took the drug and I became nauseous. These are my unconditioned things. Nothing's been learned yet. Okay? Now I'm going to add alcohol with it, and I'm going to add that drug to the alcohol. And again, I'm going to feel nauseous, right? So in this situation, I should have told you this. I'm trying to teach someone how to drink less. So I don't want you to drink as much anymore. So you're going to learn how to avert the alcohol. So aversion therapy. So I have this drug that makes me sick, right? So without any conditioning at all. Now I'm going to add that drug to the alcohol. Now the alcohol has made me sick. So then in my brain, I think alcohol and I think sick. So I'm more likely to avoid drinking alcohol. That's aversion. This has actually been done. This sounds kind of, I would say, a little far-fetched, but people do this with food. There's actually something that you can sprinkle on your food that makes you sick to your stomach, and you start to associate the food with the being sick, so you're less likely to eat more. And it's been shown to help people lose weight because they're avoiding eating. Okay, this is all classical conditioning. Now let's talk about operant conditioning. Remember, operant conditioning is reinforcing a behavior that I want and punishing a behavior that I don't. So behavior modification. This is, there's something actually with autistic kids, they use this very often. It's ABA type of training. But you're going to, I want to modify a behavior. They're not talking. I'm trying to potty train. So if I'm trying to potty train someone, remember that I'm going to reinforce the desired behavior and then punish the unwanted. So I want you to go to the bathroom in the toilet. I don't want you to go to the bathroom in your diaper. So I somehow have to have a reward for going to the bathroom and a punishment for going in your diaper. A lot of these things with the behavioral therapy, you're looking to change behavior on something that's bad for the person, right? So a lot of the times, like in hospitals, if I'm trying to get someone who is severely depressed just to get out of bed and shower, that's a behavior I want from them. So I would reinforce the showering, and I would punish somehow staying in bed. And a lot of the times in hospital situations, they use something called the token economy. Again, this is review. Remember, the token economy is when there's a wanted behavior, they get some type of coin or token that can be used for other things down the road, right? So you got out of bed, here is a token, and you can use that in later for treats or time or whatever else might reinforce the behavior. So the token itself is meaningless, but later it will have a reinforcing effect. Okay, so that's our operant conditioning. Let's transition, so ending behavioral therapy, right? So looking for behavior. Now let's transition on to cognitive, so moving to thinking. So cognitive thinking, and this is again a little, I don't want to say common sense, so you hopefully will like this a little bit more. So cognitive therapy is going under the umbrella or the thought that my thinking colors my feelings, that what I think about what just happened will affect how I felt about what just happened. So if I think that I tried really hard and I gave it my best shot, then I'll probably feel pretty good about maybe not doing so well on a test. You know what? I tried, I did really hard, I know I did my best, so I feel okay about that test. Versus if I think that I'm stupid, that my teacher didn't prepare me, then I will probably feel negatively about how I did on that test. So cognitive therapists change or aim to change the way we think about what just happened. So Beck, this is a psychologist you'll need to know for cognitive therapy. He tried this with patients who were depressed. And so what his aim to do, and he was actually kind of from the Freudian type of training, where he started with psychoanalysis, and then he thought that it might be more powerful to think about thoughts. He thought that it'd be more powerful to think about thoughts. It's a lot of thinking. So Beck tried this. His aim was to take these catastrophic beliefs we have about ourselves and the situations in our future and kind of our life, and change the glasses that we view them through. So meaning that if I view my life through these dark glasses, I will probably feel that way about my life. And he wanted to take away or expose these irrational thinkings that we have. So going back to Freud, he would listen to people talk about their dreams, and then he was more concerned about their irrational thoughts about why these things happened. Like, that must have happened because when I was in second grade, I stole something from my teacher and it's coming back to haunt me. And he kind of threw him back, like, why do people think these awful things about themselves that ultimately make the rest of their life so hard? So in cognitive behavioral therapy, it aims to integrate the new ways to think about the way we think. All right, a lot of thinking here. So aims to alter our thinking. And because our thinking colors our feelings and our actions, if we can change the way we think, we can change what we do. And this is practicing positive approaches to new situations. So cognitive thinking, changing the way we think, will ultimately change our behaviors and how we feel about our life. So here's something a cognitive therapist might do. I lost my job. That's something that I didn't. Don't spread nasty rumors. I did not lose my job. Someone loses their job. An internal belief or a catastrophic belief that someone might have is, I lost my job because I'm worthless and I'm hopeless and nothing good will ever happen to me. Okay? That might send someone into a state of depression, right? So think about thinking equaling an abnormal psychology disorder like depression. Here's a new way of thinking about it. I lost my job. Internal belief is that, you know what, I didn't really like my boss anyway. I deserve something better. This was not my fault. Something else better is coming for me. No depression comes from that. So the same stimulus, the same thing happened in my environment, but the way I thought about it ultimately changed what happened in my life about it. Okay, so that's what the cognitive therapist would aim to do, is change your thinking about your situation in hopes to change the way you feel about your life and the state that you're in. Okay, now group and family therapy was kind of at the end of this section, oddly thrown in there. Group therapy is just how it sounds. Group therapy is when you're in a group of people that have a similar situation as you. It's bad because there's less one-on-one time with a therapist, but it's good because there's this power or this feeling in numbers that you are not the oddball out, that not everybody feels this way at some time in their life. It's less expensive. You can have group ways to think of similar situations and better ways to think about things. And one type of group therapy that is actually a vocab word is family therapy. And family therapy really functions under this belief that families function as a group, not as a set of individuals. Very Gestalt-esque, right? So that the whole is different from the sum of its parts, and that the interactions we have with our family members are so intertwined and affect each other so much that anytime there's a problem, we should really address it as a family, not as individuals, as separated. Okay, so it's really wanting to take those unwanted behaviors and look at how they're affecting the entire family, not necessarily just the people within them. Okay, I lied. I'm not going to do this chart at the end. We'll do this in class because we're already at 15 minutes, and that is too long, I've been told. So in class, we will compare the types of psychotherapies we've talked about, looking at the type of therapy, what the problem is, what it aims to choose or aims to change, and then the methods used to change it. All right? Have a great night, and I will talk to you later.